Good day everyone, I am going to tackle about the fetal alcohol syndrome. When we say fetal alcohol syndrome, it is a medical condition when a child is exposed to alcohol during the mother's pregnancy. Fetal alcohol syndrome can result to brain damage and growth problems. This condition affects varies from child to child. However, the effects of fetal alcohol syndrome is not reversible. There are four fetal alcohol syndrome. The first is the fetal alcohol syndrome. It is a severe type of fetal alcohol spectrum disorder where it caused by the exposure of the child to high amount of alcohol during the mother's pregnancy. This can result to the following: facial abnormalities, growth deficit, and CNS abnormalities. When we say facial abnormalities, it affects the thin upper lips, the presence of smooth surface between the nose and the small eyes, and a small head circumference. Next is the growth deficit. It is a child weight and height is lesser compared to a normal child and increase slowly in body sizes of a fetus and infant. And last is the CNS abnormalities. When we say CNS abnormalities, it affects neurological disorders such as structural and functional abnormalities in the brain and spine. And the second type of fetal alcohol syndrome is the partial fetal alcohol syndrome. This is the individuals who have partial fetal alcohol syndrome that may exhibit characteristics to identify the condition. However, if the criteria are not met and the insufficient diagnostic criteria of the syndrome, partial fetal alcohol may either be ARBD or ARNB. When we say ARBD, it stands for alcohol-related birth defects, and ARNB stands for alcohol-related neurodevelopmental disorder. Next is the third types, the alcohol-related neurodevelopmental disorder. This is the person with ARND does not have facial abnormalities or growth problems. However, they have complication in learning or behavior and development of the nervous system, brain, and function. This is the most important complication that occurs to children with ARND, the intellectual disability and adaptive behavior. The example of intellectual disability is the children who crawl later than normal children. Next is walk later than normal children and speak later than normal children. The fourth and the last fetal alcohol syndrome is the alcohol-related birth defects. It is the children with ARBD has problems in the development of their kidneys, heart, brain, bone, and functions. Problems related to this condition to organs and their function shows a presence of fetal alcohol spectrum disorder in children, and these are the following. First is the neurobehavioral disorder associated with prenatal alcohol exposure. This is the individual with neurobehavioral disabilities have complication with behavioral challenges and learning, which is classified as neurobehavioral disorders associated with prenatal alcohol exposure. Second is the impairment of neurocognition. When we say impairment of neurocognition, it is the symptoms includes problems with ability of visual, spatial, thinking, learning, and executive dysfunction. Third is the impairment of self-regulation. These symptoms include complicity of moods and behaviors such lack of attention between different tasks and serious reaction like tantrums by children is the earliest symptoms of impairment of regulation problems. And last is the adaptive functioning impairment. This is the problem of acquiring the regular skills for social and personal development. Examples are social interaction with others and communication. Learning characteristic. While some characteristics of behavioral and educational have identified as fetal alcohol spectrum disorder, it is essential to know that students with fetal alcohol syndrome affects them depending on the type of the fetal alcohol syndrome and should be treated individually. Each student is unique in his or her own way and showing strengths and weaknesses. Students with fetal alcohol syndrome may exhibit these following. First is the difficulty with information by processing and memory. Second, attention difficulties. Third, difficulty with abstract through and conceptual thinking. And last, math difficulties, especially in computation. We moved to the educational priorities. The child exposure from prenatal alcohol exposure or PAE can result to a wide range of neurobehavioral deficits that can hinder a child's learning and function at school. As a result, a child affected by PAE needs to a diverse learning needs compared to others and can experience complication in school. These are the priorities included. First is the educational planning needs to be developed in accordance with the children's individual cognitive and learning profile. Students with fetal alcohol disorder learn throughout his or her lifetime. However, the student's developmental levels of functioning are often lower than normal children. It is important that the teacher must know the strengths and weaknesses or capability and limitation of their student. It is also accommodation and modification should be in accordance with the child's individual cognitive and learning profile. Third is the intervention needs to be focused on the habilitation of the underlying deficit that influence learning within the context of an academics or school works. When we say intervention needs to be focused, the instructions should be presented in accordance to the child's developmental and ability level. Classroom intervention should be focused on the child's changing thinking patterns and not on the skills. And parents and caregivers should provide also the activities to reinforce the everyday skills of their children. The third priority is the caregiver requires information on how to advocate for their children's needs. The student's parents and caregiver ensures that their children is healthy and safe and be equipped with the necessary skills and resources to help him or her succeed in adulthood. They should offer their love, appreciation, and acceptance to their children, and most importantly, provide and nurture for their children for the development of their personalities and identity as they mature when they get older. And lastly, by using comprehensive and collaborative approach to provide the necessary educational care for children with fetal alcohol spectrum disorder may lessen the risk of academics and school failures. When we say using comprehensive and collaborative approach, it is the collaboration between the teachers and parents that it is more important for the student with fetal alcohol spectrum disorder, as it is reduces the risk of academic failure of the students. It is important that there is communication with the teacher for the progress of their children in their academics. It's also important to understand for the teachers to have the required skills and information to accommodate their students. The educational placement. The student affected by fetal alcohol spectrum disorder shows a continuum impairment that can impact their learning. The school placement depends on the severity of the fetal alcohol spectrum disorder. They can be challenging in a classroom due to their difficulties with learning, paying attention, etc. They can be placed on specialized program or even small group at school, either at school for the necessary supervision or through intervention. However, some students with fetal alcohol spectrum disorder can be taught by both specialized program and general education by support learning and tutoring. And this will be the last that we're going to tackle, the strategies in teaching. In order to have an effective teaching strategies, the teacher must organize first the physical space. Second, Create a border around the student with the use of armrests, footrests, or a bean bag chairs, because this can help them feel secure and can calm them down. The third is place the student near in front of the room for the whole school year to help him her focus on the lesson. And the reinforcing routines and assessing with transition, the teacher should have the student perform one task at a time. Second, keep the setting arrangement consistent all year long. And third, if the activity is new to them, walk through it with them first. And lastly, the use of consistent signal when change in routine is about to happen. That's all, guys. Thank you for listening.